Have you ever wondered what it would be like to go through medical school? Well, adults and teenagers alike in Western Massachusetts can have that opportunity without the student loans, an exhausting school schedule, and homework. Here to explain how that's even possible is Peter Blain, Director of Baystate Springfield Educational Partnership that hosts this teen mini medical school, and joining him is Suzanne Hendery, Vice President of Marketing and Communications. She runs the adult program. Thank you so much for joining me today. Suzanne, we'll start with you. How did this idea even come about?
Well, first, thank you very much for having us on today. We're really happy to be here. I heard about the idea at the University of Colorado at Boulder, who was doing a similar program. They're an academic medical center, so they also have a research and teaching mission along with patient care. And it was a really great way to get the public involved in understanding what an academic medical center brings to the community. So we took their idea, gave them a call, and with help from Tufts University School of Medicine, with which we're affiliated, we started our first program 10 years ago.
And how is that compared to how it is now 10 years later? What are the differences?
You know, it's pretty much the same. We started with an 8-week program, 2 hours a week. And we go through anatomy, physiology, signs and symptoms of diseases, treatment, and we have chairs from most of our major departments, anesthesia, surgery, medicine, psychiatry, give presentations on the depth of those diseases and illnesses and treatments as they're talking to medical students, because really that's what this audience is for. And so they give medical school presentations. There's plenty of time for questions and answers, and they're there right in front of those 80 students to take their questions.
Now, before we talk about the teen aspect of it, because those, when you think of a teenager, they don't know what they're going to do with their life, they're looking at their future ahead of them. This is the adult program there, where most of these adults have already been in careers or already have pursued something that they wanted to. So why are most of them taking this mini medical school?
Great question, and there's many different answers, but we find all ages are there, from 20 and up. Some people who are interested in either going back to school for a pharmacy career, a nursing career, or to be a physician, and some people who always wanted to be a doctor and never had the time, or wanted to be a nurse, or they're caregivers for someone in their family who has a chronic illness and they want to learn more.
And it provides them with that information and
Absolutely.
that knowledge, which kind of goes hand in hand with the relationship that you guys, Baystate, has with Tufts.
Correct. That's right.
All right, so now Peter, you direct the teen side of it. You're also the director of the Baystate Springfield Educational Partnership, and the teen mini medical school is underneath that umbrella, correct?
Yes, that's
okay.
how it works, yeah.
So talk about now, this program is for teenagers as well.
And it was built from the adult program. It was modeled off of it, and it was to provide students an opportunity to see the medical field. The interest of the students kind of derives from their interest potentially in a medical career, or at least a career in healthcare. And so that's kind of the origin of the program in terms of its design. But it follows very much the same pattern. Doctors come in and present their field of expertise to the students, and questions, interactive, see different parts of the hospital, see how it operates. It's a great opportunity for them.
And you were telling me off camera that some students have even, or some teenagers have gone on to pursue careers in the medical field because of this or after this.
Absolutely. So we have several students who are in medical school right now and pursuing their aspiration that started back in 10th and 11th grade. So it's been fantastic.
What kind of, I mean, why do adults and teens, yes, they want the information that this program provides them, but do you feel it maybe gives them almost like a sense of accomplishment that they're able to take this information and actually use it to better their lives?
Absolutely. We get that response from many people. We also get responses in terms of just simple doctor's visit. What's an HDL from an LDL? Sometimes they don't have enough time in the physician's office to get all those questions answered, but they can really delve into that. And we now have over 1,500 people in this community who have our mini medical school graduates. So they are much more sophisticated healthcare consumers. We also get a lot of questions around caring for people who have illnesses, prevention and treatment, alternative methods of health care. Does this work? Does that work? And we also hear that after they've had these presentations by several of our physicians, that they feel like they have one connection to the cancer program at Baystate Health, or one connection if anybody ever needed heart surgery. They know the surgeon they want to go to because they've spent 2 hours with him, they've asked lots of questions, and they feel comfortable with him or her. And that's really important, that you feel like despite Baystate Medical Center being a big place, there's one person you can call who knows you and who will respond to your situation.
And those are the same connections that the teenagers feel as well when they are moving on?
Absolutely. With our program design, this isn't the end of their interaction. It's part of a progression, so the students stay with us and continue to build relationships within the hospital. So it's part of the initial process of doing that exact same process of connecting to the field.
Nice. Now, Suzanne, talk about the future. What does the next 10 years hold for this?
Well, the next 10 years, so far, as I was telling you earlier, it's been so popular. So we run a fall semester and a spring semester, similar to your analogy around a university. And we have 80 students per semester. It's usually very well subscribed, and we have waiting lists. So we'd like to take it beyond the bounds of the classroom. They do get a lot of experience being able to take behind the scenes tours and work in our simulation lab and see our laboratory. They really like that. But we'd like to look at television, we'd like to look at the web, we'd like look to what other universities are doing with online education and saying, how could we bring this information to hundreds of thousands of people instead of 100 people in a classroom. But we could say, we could just do mini medical school between us and we would be very busy, just in that. But what is wonderful is at the end of both of our medical school experiences, people feel like they have a real connection. They feel more informed about their health care and their insurance and all of those very complicated pieces of health care.
Great. Well, thank you so much for the information that both of you are bringing to me. I feel like I've almost been to a little mini medical school myself. So thank you guys.
Thank you.